Welcome to the Fascia-Informed Therapist, the essential podcast for occupational therapy professionals looking to deepen their understanding of fascia's pivotal role in therapy and health. I'm your host, Amy Mayer, an experienced occupational therapist, practice owner, and dedicated educator. Here we'll dive into the fascinating world of fascia, exploring its significance in the human body and its critical influence on occupational therapy practice. Each episode will bring you cutting-edge insights, expert interviews, and practical strategies to help you confidently integrate the science of fascia into your therapeutic approach. Whether you're a seasoned practitioner or just starting out, our goal is to equip you with high-quality, evidence-based, and fascia-informed continuing education opportunities that will enhance your skills and benefit your clients. So join us as we unravel the complexities of fascia and transform the way you practice occupational therapy. All health and wellness practitioners are welcome. Let's learn, grow, and evolve together. Hi, I'm Amy, and this is another edition of the Fascia-Informed Therapist. And today our topic is how we innovate, how we expand, and how we can re-energize our practice through fascia science. I have several subtopics here, and we'll go through them one by one. As per usual, I may bounce around a little bit because that's just kind of how my brain works. Hopefully, you guys don't have any trouble keeping up. I know you won't, because I know the people that I have talked to that are interested in fascia science are creative and clever and leaders and want to continually do exactly what we're talking about today, which is innovate and expand practice options. And I certainly think it's done that for me, and it's also has really re-energized my interest in my own profession and practice. And I know that ebbs and flows, especially when you've been doing occupational therapy for 32 years. Everything ebbs and flows in life, right? But I've always been curious about fascia and fascia science, and what it's done for my practice is absolutely amazing. And the people that I talk to, it's really fun and re-energizing for me when I see that roll out to the people around me. Before I go further, I want to say thank you to everybody that has been listening, because it blows me away. I checked this morning and we're up to 234 downloads, and I am so grateful that there's other people that really care about this stuff like I do. And I am truly so passionate about getting this information in the hands of my fellow practitioners, and any practitioner out there, whether they're an occupational therapy practitioner or PT or speech or counselors or nurses or whoever wants to listen. I take this information and please do whatever you want with it. Grow, innovate, expand. Okay, so the first is assessment. As therapists, the first thing we need to do when we get a new client, right, is do an evaluation. And this is also a topic I used to teach when I was teaching the phys rehab classes. I was responsible for the phys rehab assessment course, and fascia was not something that we integrated in there because, well, it just isn't commonly taught in schools. In our program, we did teach a little bit of myofascial technique, but that was not in my course. So assessment, how can fascia science improve or help us innovate with our assessment techniques? Well, first of all, it gives us a more complete picture of what's going on with the client. When we start to look at an area or a problem less microscopically, then we get a whole different idea of what's going on. And I think OT practitioners in general are really good at being holistic and taking a lot of things in mind. Then why wouldn't we include one more body system in that whole more global look at what's going on with our clients, especially now that we know that fascia is a big contributor to things like proprioception, which of course then that also means balance and movement, coordination, also a big player in interoception. It's something that we just need that layer. And I think a lot of us, when we think about how do I assess fascia, you actually have to put your hands on somebody to do that. You do not. You absolutely do not. The big things you need to know about are their history and what sorts of issues, problems, illnesses, accidents have potentially contributed to, have likely, let me keep rephrasing, have likely contributed to fascial tension in the body, which could be contributing to the problem at hand, or could be contributing to a slow healing process, or could be contributing to not making progress at all. So having that extra layer of knowledge in there might make you scratch your chin a little bit and go, okay, maybe we need to think about how we can look at the fascia and what we can do in terms of affecting the fascia in order to think about this problem and then potentially make progress. So assessment, I think, is a big piece, and the way that I integrate that into my practice is exactly what I just said, looking at their history. If you listen to the last podcast about the young lady with the TMD issues, if I wouldn't have learned about the postures that she had to hold for hours on end, that I would be missing a huge piece of the puzzle. So it does take time to go back and look at somebody's history in that kind of depth. But if it can help you solve a problem and solve it faster and get that client back to better quality of life and doing the occupations that they love and need and want to do, then it's completely worth that time. Now, I get the whole insurance piece, but that's also conversations you can have once you get going with the intervention that you're choosing to apply. Because we're all chatting with our clients once we get the intervention going, right? So we can ask maybe more pointed questions to help us get to that knowledge. We can start going back further then. The other way I integrate my knowledge of fascia science is into our posture and mobility assessment. There's not a ton of great science that says that fascia is intricately connected with posture, but it's completely logical. There's tons of research out there about how posture can affect our health, including all-cause mortality for people that have lost centimeters of posture over a specific period of time because of the pressure on the organs. That was a little tangent. But thinking about then, okay, we know that the body, from fascia science, that the body's continually reshaping itself based on the pressures that come into the body. Well, what's the biggest pressure that goes into the body? Well, it's our choice of posture and sitting and standing every day of our life. And when you blend those two pieces of science together, you can make some pretty logical conclusions about maybe how their posture contributed to their carpal tunnel, for example. And the mobility, if you have lost mobility in certain areas of your body, knowing what those mobility ranges are intended to be in a functional, normal functioning human body, typical functioning human body, then when there's loss, you know that there's probably some sort of tension in there, and that tension is probably in the fascial system. So looking at those things can help you better understand the tension in the fascial system and then how it may or may not be connected. That's what we're trained to do. We're trained as a therapist to make those connections and develop a course of action to try and resolve it to get our clients back to the occupations they need, love, want to do. Okay, so let's move on to enhancing treatment strategies. Kind of the same thing. In the free course, I'm sharing a lot of research that has come out that looks at fascia as a variable in the study that I'm presenting. And in that hour long, I just changed it. If you've already listened to the free course, I just put a new updated one out there that takes a little bit different approach. So you can go back and watch this one and get another free hour of continuing education. But I talk about research that's coming out in the area of cancer, coming out in the area of mental health, women's health, kids, all these different areas. They're looking and including fascia as a variable in this research, or it's about something relevant to the way we think. And the point I'm trying to make is, in that free CE, is look at all this fascia coming out that we probably are fascia-related research coming out that we could read and go, wow, this is relevant to us. But if we don't have the basic knowledge about fascia science, what is the anatomy? How does it function? What are the roles in the human body? We can't fully understand that research and then do a whole lot with it. So when we do, we can take that and we can go, oh yeah, okay, so this is how I'm doing this now. If I maybe tweaked it a little bit, then I could do more. I could get more effect on the system of the fascia as well as the other areas of the body that I'm trying to target with my intervention. So enhancing treatment strategies is great. We typically think about, when we think about fascia, we typically think about treatment strategies as things like myofascial release, and that is a big one. And I personally feel like we need a lot more innovation in that area. The myofascial release world has typically been dominated by a handful of organizations here in the United States and around the world. And some of them are very science-minded and some of them not so much. So having more therapists out there who really understand the science of the fascia can take a critical thinking approach to whatever brand of myofascial work they're learning, and think about how can I tweak this to when I'm working with my client and in my practice area and the diagnoses that I work with the most, what can I do to even improve on that? We need that innovation. Then that's what happens in any area of therapy or medicine or any area that educates practitioners to the level that we educate practitioners, which is we've got our assistants with a 2-year degree, we've got our practitioners with a master's or doctorate, therapists with a master's or doctorate degrees. That's high-level thinking. So let's learn the science and innovate it. We need to take that critical thinking approach, not just to myofascial release, but to all the other things that we do when we start to layer in that fascia science. The next area I want to touch on is taking a more holistic approach to therapy. And again, I think occupational therapy practitioners do a really good job of that. However, some of us take a more mechanistic approach to what we do. Or maybe we are taking the biopsychosocial approach and we're thinking about other areas, like how are they thinking and feeling about this? What's going on? But I think sometimes even when we do that, we still take that microscopic, mechanistic approach to the human body. If the problem's in the shoulder, then if the pain is in the shoulder and the limitation of movements in the shoulder, then the problem is in the shoulder. No. Well, I won't say no, I'll say maybe. Because sometimes it's true, the problem is in the shoulder, but sometimes it might be elsewhere. And I may have used this example in another podcast, but I'm going to use it again. I had a client, well, she's still a client who kind of sort of comes and goes when there's stuff going on, but a client who had a shoulder surgery and it failed. And then she had to have it again. And it wasn't because she wasn't doing her stuff. She was absolutely doing her homework and doing a great job, maybe even overdoing it. But I do not believe that the redoing of the shoulder surgery was something that she caused. But I don't know if that's even here nor there. But she was seeing a traditional therapist, and that therapist was having her do a lot of stretching in her shoulder, and she was still had quite a bit of loss of shoulder flexion. So they had her start doing lifting light weights to strengthen the muscles. They felt like, okay, there's not they couldn't really identify exactly what was going on and why she was continuing to have this limitation. They felt like she just needed more strength and she would be able to get that arm up there. When I saw her, of course, I took my Fascia-Informed approach to looking at her shoulder and could see that she could get to a certain range of motion, and asking her, okay, well, I put her in a laying down position on her back and had her move the arm up into flexion. And we talked about, well, where do you feel it? And then I'm also looking at what's happening in the rest of her body and where the pulling is coming from, and what I'm seeing and what she's feeling when she does that motion. And we identified that the resistance is really coming from lower alongside the rib cage in the area of the latissimus. And when we worked through that area and softened that up, did some releasing and stretching through there, she could get many, many more degrees of shoulder flexion. So that's just an example of when you think more broadly and more holistically, when you think and layer in fascia science, because fascia science has identified some thicker lines of fascia that we typically can see that support us functionally and protect us. When you start to think along those lines, which the work of Thomas Myers and others has made that something that's pretty clear out there in the literature, that they exist. And so when you think along those lines, that can help you. I don't think you need to know those and memorize those at all. You just need to think more holistically in terms of pulls in the body and what's going on and the sensations that people are feeling. So that's something that is, that particular story, I think, is very telling in that. I think we're still in one particular area of the body, but it's important and it's a good example. Maybe if we went a little more broadly in terms of a holistic approach to therapy, I would say that mental health would maybe be a good one to talk about. So when we think of mental health, we often, I think it's pretty commonly accepted that we need to look at all the lifestyle pieces of keeping someone with mental health issues on a healing trajectory. But are we always looking at the physical pain aspect, the limited mobility and what's happening in their body? And I really think fascia science is going to make leaps and bounds of change in the world of mental health, and knowing that there's things that we can, that this is another topic I talk about in the free CE, is how people with major depressive disorder have been identified to have thicker fascia in different parts of their body, in particular their upper back. And that might be an outcome of the tension they're experiencing. That is yet to be discovered, I think. I think that's a logical conclusion. But thinking about the study in particular was about teaching them to do self-myofascial release and how that improved their positive memory in the variable that they were looking at. So anyway, that's something that you can go look at, and the reference to the study is in that free CE as well. So the next is innovation in therapeutic exercises. One of my, I don't know if it's a pet peeve really, but giving people all these linear exercises and 3 sets of 10 is just not something that I think is a functional approach to giving people home exercise programs and things that they can do to make changes in their body. The body needs gentle consistency over time in order to really make positive change, not, 3 sets of 10 of something once a day. It's just, and the linear piece, just no. It's not, okay, I won't say just no. It's just not functional. In most cases, it's just not functional. In the fascia science course, the bigger course, I talk more about what are the things that the research is saying that we need to be including in how the body moves and in our exercise, because we're not using our bodies the way that they're designed to be used, right? So what should we be including in our exercise? And there's a lot of talk about intensity and I'm not even going to say it right, the VO2 max and things like that. I mean, important, not unimportant, of course, but most people are not going to be doing the intensity that we really need to be super healthy and to age super well. But what are the minimum things we need to do with our body to start with, and then I think integrate them as we increase our frequency and intensity of exercise? Because first you have to move better, move well before you move often. If most of us are taking a body with sticky fascia and poor posture into a new exercise program, you're going to get injured. And I have seen it happen way too many times. So what does the body need? Okay, we need regular movement. As I said, gentle consistency, regular movement throughout the day, even if it's just for very short bouts and even if it's different things the whole time. The next is variety. We need variety of movement. I've talked in other podcasts about how when we always cross one leg over the other when we're sitting, we're going to create a structural imbalance in our fascia, in our hips, and our legs, and that's going to cause problem. Same thing with our movement or exercise. We need variety so that we don't create imbalances in our body. Expansion. We need expansion. That means like opening and extending. I'm reaching it. I'm standing in a huge X position right now with my elbows straight and my knees straight, my fingers spread. Expanding, getting as big as possible and finding those end ranges of motion. And then the next is compression. Getting yourself down into the teeniest tiny squat little ball that you can possibly make your body. That expansion and that compression actually is like squeezing the sponge and moving the fluids. Twisting motions. There's a wonderful book that just came out. I'm not going to remember the name of it. It's something about spirals and how our body really operates on a lot of spirals. And if you stretch your arm out and turn your palm down and twist the arm around as far as you possibly can without moving your rib cage, and then twisting that arm in a spiral really helps to wring out the tissues throughout the arm, especially in the forearm. And so that, when's the last time you gave out home exercise like that? Bouncing and jumping motions really help to put more crimp back in the fascia, and that's what we need in order to really create protective fascia. Movement into the end ranges of our joints. I mentioned that, but how often do we do that? If you're saying, just get out there and walk, we're not even close to bringing our joints to their end ranges of motion. And of course, resistance. We need, I talk about the fascia all the time, but the body as a whole and the myofascial unit, it's not really even a unit. It all works together. We need that resistance to build strength. We need strength in our bodies. Yes, absolutely. We need to be really careful if we are building strength faster than our fascia can remodel. That can cause problems too. And then the last one I'll say is mindfulness of movement. We often move too quickly through our exercise. And if we really want to build that proprioceptive skill, paying attention, moving slower through some of our exercises can be really helpful with that as well. The next area I want to mention is patient education. I did a podcast a few ago, maybe 4 ago, about fascia science and becoming fascia-informed human, and how I had heard a therapist out there speaking to her own audience, not an occupational or physical therapist, but different kind of therapist, saying that patients never need to know about the science. Your job is just to fix them. I could not disagree with that more. I do think that people do care about what's going on inside their bodies. They want to know, they want to understand. We just had Caitlin and evaluated a new client recently, and she said that this client literally started crying in the office during the evaluation because she felt like she understood her body in a more complete way. And she felt so listened to, and she felt like she was being given information that, she was being given information that nobody had given her before. But since it helped her feel more normal in her body, more like there was an answer for her, that just touched her deeply. And that's providing the science. And it's providing the science in a way that your client, your patient can understand. And that's the important piece of it. The science is important for you to make better decisions about what you're doing, but it's also important, and I think OT in particular are super good at really boiling it down and getting to know their client in order to really explain it to them in a way that's meaningful. And that's one of the reasons that we do all of our evaluation process in person. We don't do anything online that they fill out ahead of time except the waiver forms and things like that. We want to hear their story because we can often connect the science with their story. And when you do that, it connects. It lands with them in a way that they can understand it. So teaching our clients about the fascial system and how they can properly take care of it, how it may be responsible for some of what they're experiencing in their body. And then it's so empowering when they hear about what they can do. And there's so much they can do and not be reliant on us. Then finally, interdisciplinary or cross-disciplinary collaboration. The science is here. It's not in textbooks yet, although it is. The Occupational Therapy and Acute Care textbook is now out in ebook form, and the hard copy hopefully will be here shortly. But it's coming. It's finding its way into our textbooks. It's finding its way into our continuing education world. It's finding its way into many other areas, like I've talked about in another podcast, which is beauty, which is sports, which is yoga. So it's going to find its way into medicine and all these traditional areas of practice. And what I want for my discipline and all the disciplines that we work with is to be ahead of the game, to learn the science, be aware of these studies, and make a change, make a difference with your clients now. And then be ready as it starts to spill out and more practitioners are talking about it. You can be part of that conversation. So that's enough. That's a little longer than I typically go. But I hope you found value in this. And I'm always open to people reaching out if there's conversations you want to have. I would love to start interviewing. I've got a few people lined up. It's just a matter of finding the time and connecting with them and getting them on the podcast and moving forward. So thank you so much again for listening and hopefully sharing and expanding our reach. Have a wonderful day. Thank you for tuning in to the Fascia-Informed Therapist. It's been a pleasure sharing insights and strategies to help you integrate fascia science into your practice. I'm Amy Mayer, and I hope today's episode has inspired you to explore further and take your therapeutic skills to the next level. Remember, we're committed to creating and providing top-notch, evidence-based, fascia-informed continuing education that empowers you as an occupational therapy practitioner. Stay connected with us for more enriching content, and don't forget to check out our online courses to deepen your expertise. Until next time, keep expanding your knowledge, refining your skills, and confidently applying the science of fascia to your practice. Here's to advancing together in health and wellness.